My name is John-Gabrieli. I'm a professor of cognitive neuroscience at MIT and a member of the McGovern-Institute for Brain Research. My research program involves studying learning and memory in the human brain. And originally, it was a fairly narrow perspective on learning and memory, how you remember a specific experience or how you learn a specific fact. But over time, from neurosciences and psychology, we understand that the full range of human experience involves learning. Learning how to have an emotional response to a situation, learning how to be resilient to adversity, learning how to solve a problem that's difficult. So over my research career, I've moved from a fairly narrow sense of learning and memory to studying almost all facets of human experience, because it turns out they all involve learning and memory as we evolve from childhood into adulthood. For me, the very big question is learning and plasticity in the brain, how the brain allows us from infancy, when we can do so little, to become adults who can do so much. All these capacities that grow in us that allow us to be rich, strong, effective humans, and to understand the fragility of that, how any talent a human has can become a difficulty if something happens in the brain. Brain imaging has had a fantastic influence on our ability to relate what we know in neuroscience to humans. And now many scientists at many centers are investigating the brain bases of human thoughts and feelings, as well as how they're different in patients with difficulties. And so it's just revolutionized our chance to understand how the normal human brain or the diseased human brain works. The McGovern-Institute for Brain Research has an outstanding facility in terms of technology to study the human brain. We are able to use magnetic resonance imaging to look at brain function and structure. We're able to use MEG to study millisecond patterns of thinking and perception in the human brain, and as well as EEG to look at other forms of moment-to-moment thoughts in people. So across these different forms of technology, we really have all the tools to look in depth as far as possible into the workings of the human brain. One of the great promises of neuroimaging that we're very excited by is whether we can identify diseases very early. Can we identify dyslexia or risk for dyslexia in a child before he or she tries to read and intervene and have them never fail at reading? Can we intervene in somebody on a path towards schizophrenia before they have a psychotic break, before there's a trauma for themselves and their families? Can we intervene in somebody who's on a path towards Alzheimer's disease before the disease is so severe that it's hard to treat? And so we're very excited whether neuroimaging will let us see inside the brain for a person at serious risk for a disorder and allow us to do something for that person so they never have the worst version of that disorder at all. We think imaging could make a real difference in identifying which patients will benefit from which kinds of treatment. There's now almost a lottery aspect to a doctor deciding which drug to give to a child with ADHD, which drug to give to a young adult with depression. And we know that only about half of patients will respond well to any particular medication. And so rather than sort of reassigning treatment by failure, we're hoping that brain imaging will allow us to identify brain markers that can predict which individual will really benefit from which treatment. A remarkable advantage of doing work on human diseases at McGovern-Institute for Brain Research is that we're in the very heart of a giant biomedical research environment in the Harvard hospitals, Boston University, and Tufts. Many of the leading neurologists and psychiatrists in the world perform the research blocks from our imaging center. And so we can establish and have established many productive collaborations that take the very best physician researchers and tie them in with the strongest imaging we're able to do. The rate of change of knowledge, how much we're learning about the human brain, is so fantastic that it's hard to believe that we won't make great insights in the coming years. The brain turns out to be extraordinarily challenging to understand. I think we have extraordinary tools to do it now. The rate of knowledge accumulation is so great, the range of novel tools are so wonderful, that it's hard to believe that we won't do something really terrific. When that moment comes is the mystery for us, but if we all work hard as creatively in an environment as wonderful as MIT and McGovern, we really think we will make major breakthroughs.